Assalamualaikum, this is Dr. Imtiaz. Today we will discuss about acute rheumatic fever, epidemiology of acute rheumatic fever, clinical feature, diagnostic criteria, management. Okay. Epidemiology of acute rheumatic fever. Peak incidence, age is 5 to 15 years, twice as common as in girls. Okay, clinical features major, minor. Major as like on Jones, Jones, Jones. Joints, migratory arthritis, in heart, O for heart, carditis, nodules on the subcutaneous tissue and skin, erythema marginatum, okay, Sydenham chorea, okay. Here is the Sydenham chorea, carditis, Sydenham chorea, migratory arthritis, sometimes here, sometimes here, and sometimes in migratory arthritis, erythema marginatum in the skin and mostly on the shin area. Okay, minor criteria is fever, arthralgia. Arthralgia is just joint pain, and arthritis is the inflammations. Okay, arthritis is inflammation, arthralgia is a joint pain. Elevated ESR, erythrocytes, ESR and CRP, prolonged PR interval. This is a minor criteria. Late sequel is mitral regurgitation first and then progress to mitral stenosis. Okay, mitral regurgitation and then mitral stenosis. Okay, prevention is the penicillin for group A streptococcal, Streptococcus pyogenes pharyngitis. Okay, penicillin, streptococcal A and B. Okay. Now we discuss about diagnostic criteria. Evidence of preceding group A streptococcal infections along with two major criteria. Okay, one is criteria is that evidence of preceding streptococcal A infections along with two major criteria are one major plus two minor. The second and third, if either of Sydenham chorea or carditis are present. Sydenham chorea or carditis are present. Okay. Now we discuss about management. If pharyngitis, often self-resolve, but give a 10-day course of oral penicillin to prevent acute rheumatic fever. Okay. If acute rheumatic fever is present, even in the absence of active pharyngitis, treat acute rheumatic fever long-acting benzathine penicillin G. Okay, benzathine penicillin G through IM, intramuscular route. Okay, until adulthood, eradicate bacterial carriage to prevent the recurrent acute rheumatic fever and worsening of the rheumatic heart disease. Okay, if severe chorea is present, then the treatment of choice is corticosteroid. If pericarditis or arthritis present, if pericarditis and arthritis are present, then the treatment is NSAID. Okay.